So we have to use erectile aids, and the one that is most commonly used is a penile prosthesis, which is an internally self-contained apparatus that involves placement of a silicone cylinder that can be compressed and that can be filled with fluid. When it gets filled with fluid, that's when erection happens. That cylinder is connected to a pump that goes in the scrotum and is connected to a reservoir which stores the fluid. And the idea is that you, whenever you feel like you're having an erection, you squeeze the pump multiple times, that transfers the fluid from the reservoir to the cylinder, and it stays erect until you feel like you're done with it. So whatever you're gonna do with it, masturbation, penetrative intercourse, whenever you feel like you're done with it, you squeeze a button on top of the pump and the erection goes down. At the same time, so as we put in the pump in the scrotum, that fills up one side of the scrotum. The other side of the scrotum, to make sure it's not empty, we can put in a testicular implant at the same time as we do the penile implant. The penile implant that we use in the United States is not made for putting it in neophalluses. It is made for natal penises. So if someone has a phalloplasty, say for instance a cisgender gentleman after traumatic penile amputation, or a transmasculine individual, that neophallus is not suited for the implants that are commercially available. So we have to modify those implants. So typically we have to instead of two cylinders, we have to convert it into one cylinder, we have to anchor it to the bone and so on and so forth. Mm-hmm. That modification of the device makes it less robust. It is a hydraulic device, as you can tell, and that modification probably increases the rate of mechanical malfunction of the device. So that's number one. Secondly, there are no natural barriers of tissue as there are in natal penises between where the device is situated and the outside world. So there's a high rate of infection and erosion. So erosion meaning the device can slowly work its way out externally, poke out at the head of the penis or somewhere else, or get infected. Where we secure it to the pubic bone, for instance, it can become dislodged. The complication rate for erectile device is very time dependent, but it's 100%. So after enough time has elapsed, every single erectile device that we put in is going to either stop working or erode or disconnect and things like that. And if that happens, we have to take it out and put a new one back in. Some of our patients don't want to have an erectile device for that. It's 100% guaranteed complication rate. But during the time that it works, it actually works pretty darn good.
How long do you normally, if someone's able to go without any really significant complications with their device, how long do you expect the device to last?
In cis men, a non-modified device lasts for about 7 to 10 years. Okay. A modified device is probably the median survival of the device. That is, the time at which about 50% of the devices will have a malfunction is probably between 3 and 5 years. So I always tell folks that think of it as a 3-year thing.
Doing a surgery that frequently lead to more complications for folks, or how does that usually work in terms of the success of the surgery if you have to put a new implant in?
Yeah, surprisingly, the scarring inside of neophalluses after a phalloplasty, after a device has stopped working or infected and we take it out, surprisingly the scarring is not that bad. When I initially did a few redos, I was like sweating. I was like in anticipation this is going to be terrible because I've done a lot of redos in cisgender men, and it's very challenging to go back in after you've removed a device. And I was like, oh, it's going to be that and then some, but it's not. I think it's just because there is a lot of blood supply. The tissue is fatty tissue rather than tissue that forms to scar internally. So that aspect is not that bad. Not saying it's a chip shot, but it's not that bad. The problem happens when the device causes, so the device not just got infected or malfunction, but the device caused some other damage to the flap. So if there's an erosion, and then it causes partial loss of the penis itself, then you can't just put in another device. You have to reconstruct that lost segment and then talk about reconstructing. So those are the things that can definitely happen. Thankfully, not very commonly, but they